Chocolate toxicity is basically a toxicity that occurs when your pet ingests chocolate of any kind that can range from cocoa powder all the way to like white chocolate, anything that has chocolate in it. The toxic chemical in most chocolates is something called methylxanthines. So at lower amounts, we're more worried about GI upset, so vomiting, diarrhea, maybe sometimes belly pain. Higher up, you start worrying about increased heart rates, increased blood pressure. Sometimes they can have what's called an arrhythmia, which is an abnormal heartbeat. And then at really, really high doses, we can see things like seizures, tremorings. Occasionally it can be fatal if it's a very large amount that's ingested. So when a patient comes in that's ingested chocolate, the first thing we want to do is try to induce vomiting, to try to get as much chocolate out of the body as we possibly can. So we'll give the dog an injection of a drug called apomorphine, which is a drug that'll induce vomiting. Once they're done vomiting, we always give them anti-nausea medication to kind of stop any additional vomiting. Some of our next steps may be to check an ECG to make sure that the dog does not have any arrhythmias. If they do, then we may need to think about starting medications to lower the heart rate. If they do not, then more than likely at that point move on to some more symptomatic care. So we'll often give the dog a dose of a drug called activated charcoal, which is a medication that'll go in, it'll bind any additional toxins, and basically the goal is to prevent them from being recycled and reabsorbed through the body. Additional meds we may do for dogs that have ingested chocolate would be some fluids, whether that's IV if they're going to stay in the hospital. If the dog is having seizures or tremors, then we're going to want to hospitalize for aggressive IV fluids and medications to help stop those twitches and tremors. In extreme cases, we may think about doing what's called a gastric lavage, where we kind of pump the stomach, so to speak. That's very uncommon. Usually just inducing vomiting is enough. If the dog develops a condition called pancreatitis, which is inflammation of the pancreas, we may bring in a specialist. Pancreatitis can be diagnosed off of an ultrasound, so if we do need to involve a specialist with these cases, it would be our radiologist to do an ultrasound of the belly and make sure the pancreas looks okay. If you believe your pet has ingested chocolate, it's always better to err on the side of caution and get them seen, even if it's a small amount. Our emergency department would be happy to see your pet and try to give them the best outcome possible.